The R.K. Khan Hospital in Chatsworth, Durban, has been in the spotlight in the past few months because of the number of staff who've contracted COVID-19. Now, many of the hospital's patients have also had to be moved to other healthcare facilities because of this. Lethiwe Mdluli has been tracking the story for us. She joins us now live from our Durban studio. So you had a chance to speak to one of the people who had their test done today. What are they saying?
Well, Shahan, I did speak to a few people who actually had their rapid test done today, and they actually said it was a quick and fast process. They actually did say that they were kind of skeptical to go to the hospital because of the number of negative reports in the press and also what has been happening at the hospital. We know that a lot of healthcare workers, beginning of the second wave of COVID-19, tested positive, and because of that, the hospital was under pressure, and there were reports that patients were being diverted to other hospitals. While speaking to one person who went to get their test done today, this is what he had to say.
I know this is hasn't been a very popular place for same reasons why I didn't want to come, but now that I've been here, I found it quite quick and efficient.
Now, this hospital has, of course, faced some tough times recently with healthcare workers testing positive.
Yes, Shahan, like I mentioned before, the healthcare workers who tested positive at the hospital, there was quite a large number of them, and because of this, it faced some tough times. While speaking to a non-profit organization earlier on this afternoon, the organizations did say that they wanted to lay a hand of help to the hospital and also partner up with the Department of Health just to make sure that every person who comes to get their rapid test done feels safe, and that the public is actually open to coming to the hospital and get this test done. I spoke to a volunteer from COVAC, and this is what he had to say.
The numbers are astronomical. KZN is in a dire problem. We are virtually 1/3 of national numbers daily. People need to seriously wake up and understand that if the numbers continuously increase, we are not going to be able to actually be saying we'll see you tomorrow. And I think people have to understand that we need to follow the basic rules. It can become tedious, it can become boring, but you know, the saying is going as people is, if you don't do that, the only person who will be taking care of you will be the undertaker.
You also spoke to DENOSA about these rapid tests that are being offered. What are their views?
Well, DENOSA is quite happy of the test being done because of the effects that COVID-19 has had on healthcare workers. Among the healthcare workers that were most affected were nurses. So they actually came out and said these rapid tests that are offered at the hospital might actually lessen the burden on healthcare workers at the hospital and as a whole. And they're actually saying that more rapid tests and more sites like this should be erected by the Department of Health so that people can get or go to these testing sites instead of actually going to the hospital once they experience some symptoms. I spoke to DENOSA's provincial secretary, and this is what he had to say.
When many people are doing the screening out of the hospital, that will assist to lessen the burden. Only those people who really need admissions will come to the hospital. But for simple testing, it will really reduce the burden in the hospital, and that will give it time to nurses to also focus on those who are critically ill.